Here at Barcelona, at one of the late-breaking clinical trial sessions, the SPYRAL off medication trial has been presented, a first interim analysis of 80 patients that have been randomized to receive either sham treatment or renal denervation. These patients were washed out with their antihypertensive medication or were drug naive, so there was no concomitant antihypertensive medication administered in these patients. And it was nicely shown that at 3 months there was indeed a significant reduction in both office and ambulatory blood pressure, and that was superior, more pronounced than in patients who received sham treatment. I think it is very important news because it provides the biological proof of principle that renal denervation lowers blood pressure in the absence of antihypertensive drugs in patients with uncontrolled hypertension. There were key learnings, with respect to the patient population. So we're excluded in the current SPYRAL hypertension off medication trial, indeed patients with isolated systolic hypertension. These patients have very stiff arteries and they are probably not prone to respond to renal denervation or any kind of neuromodulation. This is the first big confounding factor and a key learning. Another confounder that we identified is the procedure itself. You might recap that there is no intra-procedural parameter that guides us in helping, we achieved a percentage of nerves that have been affected. And on the other hand, we learned about the anatomy. So the approach and the catheters have been revised. We are more actively going into the branches, into the smaller arteries, providing more circumferential and more complete renal denervation. That is the second key learning. And as I mentioned, medication and concomitant antihypertensive medication in such trials is very difficult to assess on the one hand. On the other hand, it introduces a lot of noise to the data with respect to adherence and fluctuation in adherence of these patients. So the purest population to prove that any device is working is probably the patient population where no antihypertensive drugs have been administered, and that has been carefully checked using toxicological analysis, so we can really say that these patients have not taken any antihypertensive drugs while being in the study and being analyzed for the primary endpoint. With respect to identification of patient profiles or hypertensive phenotypes that will respond to renal denervation, there's more to come. We have to conduct more research in order to identify patients probably prior to the procedure and saying this patient has a high likelihood of responding to neuromodulation by renal denervation. We have learned that, again, isolated systolic hypertension, stiff renal artery, high pulse width velocities, high central pulse pressure, these patients do not respond as good as patients with smoother periphery arteries. And I think in the future one of the major research topics will be to identify patients with specific profiles that will respond to renal denervation more properly than others.